Chapter 25, Apoplexy with Xingnao Kaiqiao Acupuncture Method. Apoplexy, known in Western medicine as cerebrovascular accident, consists of several types of diseases, such as cerebral hemorrhage, cerebral thrombosis, and cerebral embolism. An attack of apoplexy can occur to a person when he is up and about or asleep. Blood circulation is indispensable to any part of the human body, especially the brain. If the brain is in short supply of blood for a mere second, it will cause irreversible damage. Adequate blood supply depends on a sound vascular system. Hypertension and hyperlipemia restrict blood circulation, weaken the vascular system, and induce arteriosclerosis. Rough endarterium leads to thrombosis. High blood pressure and a damaged artery can result in the rupture of the blood vessel, which can lead to cerebral hemorrhage. A hematoma formed on the brain puts pressure on the normal cerebral tissue and can be life-threatening. An emboli can be formed in the auricles of the patient with arterial fibrillation. If the emboli scales off, it may enter a blood vessel of the brain, which can immediately cause cerebral infarction. Although the pathologies are different, they all cause damage to the brain. Therefore, the resulting manifestations are quite similar. The symptoms of the disease may include coma, dizziness, headache, hemiplegia, aphasia, etc., depending on various degrees of the damage. In modern medicine, cerebrovascular disease can be diagnosed accurately, but there is no satisfactory treatment for the disease. Death, maim, and sequelae are all high. Many patients' lives are saved, but they have all lost self-viability forever and become a great burden to their families and to the society as a whole. Traditional Chinese medicine has a unique explanation of apoplexy. Neijing recorded that pathogenic blood and pathogenic qi go upward together, leading to deep coma and apoplexy, which means the patient will suffer from a sudden death. If there is a reversion of the primordial qi, the patient can be saved. Otherwise, he will pass away forever. Professor Shi Xuemin has done much research on and has extensive clinical experience dealing with apoplexy. He has taken a look at the change of the theory on apoplexy over thousands of years of Chinese history. From Zhang Zhongjing of the Han Dynasty to many medical experts of the dynasties of Jin, Sui, Tang, and Song, they all supported the theory of exopathic wind. This theory claimed that the disease was caused by the invasion of exopathic wind. Therefore, the treatment is to dispel wind and relieve superficial syndrome by means of diaphoresis. Diaphoresis is a treatment very similar to that for treating the common cold. Obviously, they are two totally unrelated diseases, and the treatment had, of course, little effect. In the dynasties of Jin, Yuan, Ming, and Qing, There are many theories for the treatment of apoplexy. Among them were Liu Hejian of the purgative school, attributing to excessive heart fire, Li Dongyuan of the spleen and stomach school, stressing deficiency of vital qi, Zhu Danji of the nourishment school, emphasizing the factor of phlegm. Different though their theories about the causes of the diseases were, they were all based on a combination of internal and external factors. Not until the end of the Qing dynasty was the theory of endogenous wind as the major etiology established and elaborated. It was widely accepted as the pathogenesis of the disease as endogenous, caused by upstirring of liver wind combined with pathogenic qi, blood, phlegm, and fire rushing upwards. It was extremely difficult to find a proper therapy to cure the disease if the pathogenesis varied so greatly. Since the main symptom of apoplexy is hemiplegia, most practitioners of Zhenjiu view the disease as atrophy syndrome and follow the treatment principle to cure atrophy. Only points on Yangming meridian were selected. The treatment has been adopted and used for all these years with good results. However, it is not considered a permanent cure, as it did not attack the origin of disease. After making a comprehensive study of apoplexy cases of both history and present time, and based on the observations of clinical manifestations, we came to realize that the endogenous wind stirring inside is the symptom. Phlegm, fire, and deficiency of qi and blood are the cause. An imbalance of yin and yang is the turning point. The endogenous wind stirs inside, losing control and rushing upward to the brain with several pathogenic factors, resulting in the obstruction of meridians, blockage of the brain orifices, malnutrition of brain nerves, and disorder of vitality. Therefore, the major pathogenesis of apoplexy is a blockage of orifices and concealment of vitality. Accordingly, the treatment principle is to activate the brain, open orifices, and nourish the liver and kidney, and, as supplementary treatment, to dredge the meridians. After many years of research and clinical practice, Shi Xuemin established the Xingnao Kaiqiao method, including the most effective points and best acupuncture method for treatment of the disease. The effective points are Ren Zhong, Nei Guan, San Yin Jiao, Ji Quan, and Wei Zhong. The therapy is remarkably effective, with little side effect. In many cases, the patient is seen to start recovering right after treatment. The paralytic is able to function, the unconscious come to consciousness, and the aphasic patient is able to talk. In the past 16 years, over 10,000 patients have been treated with this method. Among them, 3,207 patients were observed systematically in the hospital. The curative rate is 57.8%. Effective rate, 98%. First, needle bilaterally, 内关, 1 cun with reducing method. by twirling the needle for 1 minute. Neiguan is the luo point of the pericardium meridian of the hand, Zhuiyin. Needling it can activate the brain, opening orifice, and regulate qi. The manipulation should be performed using 2 hands at the same time. Then puncture ren zhong with a bird pecking method until the eyes moisten or a tear is shed. Renzhong is an important point of the Du meridian, connecting with the brain, and governs the yang qi of the body. Puncturing Renzhong can stimulate vitality. To puncture Renzhong and Neiguan together can achieve the purpose of activating the brain and opening orifices. Needle Sannianjiao obliquely 1 cun along the posterior aspect of the tibia with the angle of 45 degrees. The needle inserting method is different from that of the traditional one. Sannianjiao is the convergent place of the meridians of the spleen, liver, and kidney. All the apoplexy patients have a yin deficiency of their liver and kidney. Puncturing Sannianjiao with reinforcing method can tonify the liver and kidney to supplement congenital foundation of the patient. The degree of manipulation should be such that the patient is seen to have twitched his lower limbs for 3 times altogether. When needling Wei Zhong, the doctor should fix the patient's knee joint in the raised and stretched position with his own elbow joint. Puncturing Wei Zhong 0.5 to 1 cun with reducing method by lifting and thrusting the needle until the lower limb twitches 3 times. Wei Zhong is the Hexi point of the bladder meridian of the foot Taiyang. Puncturing Wei Zhong with the reducing method by lifting and thrusting the needle can activate the meridian qi, relax the tendons, and dredge the channels. In the Xingnao Kaiqiao method, when puncturing jiquan, one must needle the point, which is 1.5 tun, to the inferior of the fixed jiquan point. Needle perpendicularly 1 to 1.5 tun until the upper limb twitches 3 times. Jiquan is in the center of the armpit, where there is an abundance of hair and sweat glands. In order to avoid infection, we have to follow exactly the puncturing principle that prefers to lose the point rather than the meridian. Puncturing 尺则 perpendicularly 0.5 to 1 tun with reducing method by lifting and thrusting the needle until the wrist joint twitches 3 times, while the upper limb is in the half flexed posture. Puncture 合谷 towards the 二间 1.5 tun to the effect of dredging the meridian to restore the normal functions of the fingers. The manipulation is different from the traditional one in that it makes the tip of the needle reach the metacarpophalangeal articulation of the index finger. Puncturing 合谷 with reducing method by twirling the needle for 1 minute can make the clenched fingers relax. Pseudobulbar palsy may happen to patients with repeated attacks of apoplexy. Its main manifestations are coughing while swallowing and crying and laughing at the same time. Quite often, the patients die of malnutrition and inhalation pneumonia. It is acknowledged internationally as incurable. Some patients' lives may be saved, but they have to maintain their lives by relying on nasal feeding. They have lost their ability to chew and cannot eat food anymore. Xingnao Kaiqiao therapy is quite effective in treating pseudobulbar palsy. To begin with, needle bilateral 内关 with reducing method by twirling and lifting and thrusting the needle for 1 minute. Then puncture 人中 with bird pecking method until the eyeballs moisten and a teardrop has fallen. Puncture 风池 一风 and 丸骨 with reinforcing method by twirling the needle with high frequency and a small amplitude for 1 minute. Please pay close attention to the direction of needling, for it is of vital importance here. The needling of the 3 points, 风池 一风 and 丸骨 should be directed to the Adam's apple only, and the method shall be twirling the needle with high frequency with a small amplitude. Otherwise, it has little effect. Of 113 cases treated clinically, the curative rate is 57.6%. Effective rate is 98.9%. Many patients can come off nasal feeding and begin to eat by themselves 1 week after they are treated with the therapy. This patient, after 1 week of treatment, has recovered fully. Now can ingest both liquid and solid foods. Sudden attack of apoplexy may cause some patients to have severe dyspnea, central respiratory failure, before death. The present treatment is ineffective and the death rate is almost 100%. Puncturing qi can save some lives. Of the 26 cases being treated with the therapy, the effective rate is 27.2%. Look at the health and vitality of this gentleman. This is an apoplexy patient whose life was saved by acupuncture treatment. Aura of apoplexy is a primordial syndrome marked by dizziness and headache, numbness of the forelimbs, slurred speech, deviation of eye and mouth. Of 110 cases treated with Xingnao Kaiqiao method, the curative rate is 61%. The effective rate is 90%. Only 5 cases relapsed into apoplexy during an observation period of 3 years. Points selected for the treatment: majors, 内观, 人中, 印堂, 风池, 上心, and 百会. Minors, 季全, 尺泽, 尾中, and 下林椒. The method: puncture bilaterally 内观 1 cun with reducing method by twirling and lifting and thrusting the needle for 1 minute. Then puncture Renzhong with bird pecking method until a teardrop is shed or the eyes moisten. Puncture Yingtang with bird pecking method for 1 minute. The stimulation should be lighter compared with the stimulation for puncturing Renzhong. Inserting the needle on Feng Shi and Shang Xing towards Bai Hui with bird pecking method can obviously reduce needle pain. Needle with reinforcing method by twirling the needle in high frequency and small amplitude for 1 minute. The direction of puncturing is of vital importance. It should be directed at Feng Shi 1.5 to 2 cun toward the throat. A different method from the traditional one. Experiments confirm that applying the points punctured with the method could remarkably improve the cerebral blood flow of the basal artery. Thread needling from Shangxing toward Bai Hui has the effect of activating brain, opening orifices, and tranquilizing. The manipulation method for Jiquan, Chizhe, Weizhong, and Sanlianjiao in the treatment of aura of apoplexy are the same as that of apoplexy. Puncture Jiquan and Chizhe until the upper limb has twitched 3 times, while the upper limb of the patient is in half flexion posture. Puncture Weizhong and Sanlianjiao until the lower limb has twitched 3 times. In order to take a more accurate look at the curative effect of the therapy, 60 patients with similar complaints were selected and randomly divided into 2 groups with 30 cases in each. They were treated respectively with Xingnao Kaiqiao acupuncture method and traditional acupuncture method. The results indicated that there was a significant difference in the curative rate between the Xingnao Kaiqiao group and the traditional group, with the former at 76.7% and the latter at 36.7%. A significant difference was also shown in blood rheology. The blood viscosity of the patients with the Xingnao group was greatly improved, while those with the traditional group showed no change. The clinical observation using electrophysiology indicated that the Xingnao Kaiqiao acupuncture method could remarkably improve cerebral blood supply and circulation state of the small vessels. In animal experiments on tolerance of hypoxia, it was shown that the acupuncture method could greatly prolong their survival time. The results of the experiment have been recognized and passed by the panel organized by the Science and Technology Committee of the Municipality of Tianjin. In China, apoplexy is a common and serious disease. In order to reveal the acupuncture mechanism of Xingnao Kaiqiao acupuncture method, and to study the objective reaction of the body to acupuncture, Professor Shi Xuanmin presided over a series of experiments on animals in 1986. To begin with, animal models with hyperlipemia, thrombosis, and cerebral anemia were selected. All the animal models are randomly divided into 3 groups. The first group is treated with Xingnao Kaiqiao acupuncture method. The second group is the control group, without acupuncture treatment. And the third group is a blank control group, fed with ordinary food. The results indicated that there was a significant difference among the 3 groups statistically. In the treatment group, the cholesterol level was remarkably lower than in the non-treatment groups. Its cerebral flow greater, and the ability of deformation of red blood cells better. The research of the effects of Xingnao Kaiqiao method on hypertension was performed in the medical department of Kitasato University in Japan. The mice with naturally developed hypertension and normal blood pressure are randomly divided into 3 groups. One group was treated with Xingnao Kaiqiao method, called the Xingnao group. One was punctured in places on the body not considered acupuncture points, thus called the non-point group. The last one receives no treatment of any kind, thus being the control group. After a 14-day experiment, the results were the blood pressure of the mice in the Xingnao group were lowered, but no change appeared in the mice of the non-point group and the blank control group. All the mice of normal blood pressure in the 3 groups remain the same. Statistics show that the Xingnao Kaiqiao acupuncture method can lower the blood pressure of hypertension, but have no effect on normal blood pressure. The above 3 successful animal experiments have shown that the Xingnao Kaiqiao acupuncture method is effective because it lowers blood lipid levels, decreases blood viscosity, lowers hypertension, and improves blood circulation and the state of red blood cells, so as to let cerebral tissues regenerate and their functions be recovered. The excellent achievement of this experiment has been recognized by the National Administrative Bureau of Chinese Pharmacology. It was elected as an excellent achievement of major theoretic significance in the realms of clinical medical research and basic research for both the city of Tianjin and the whole nation. Xingnao Kaiqiao acupuncture method has been promoted across the country and has been introduced all over the world, serving humanity by benefiting apoplexy patients.
路漫漫，披迹相伴，